Hello, I'm Mel Abbott from Empower Therapies, and I'm a certified Master Practitioner of NLP. NLP is Neuro-Linguistic Programming, and it's a wonderful technique that provides really fast and effective treatments for a wide range of situations and problems that people experience. Today I have a client with me who's here to resolve hay fever. Now, she's had hay fever for 50 years. And what you'll see in the video that you're about to see is that she makes enormous change. Addictions is another common thing that people use NLP for. Weight issues, anxiety, stress, depression, fatigue, phobias, insomnia. The list goes on. There's a wide range of problems that people use NLP to resolve, and people generally only need between 1 and 5 sessions to create all the changes that they want, thus making it a very affordable treatment and a very gentle and effective one. So Lesley, you've come for an NLP session today to resolve your hay fever, is that correct?
That's correct.
Yeah. So if you'd like to tell me first of all, how long have you been having hay fever for?
Well, since I was at secondary school.
Secondary school, okay. And how often do you get hay fever?
In the summer months of the year.
Summer months, yeah. And during those months, how often would you have hay fever?
It varies. I might have it every day for a week or two, and then I might go 2 or 3 weeks or a month and not have it.
Okay, so it's quite patchy.
It's patchy.
Yeah, but when you get it, it's likely to last for quite a few days.
Well, of course, if I take medication.
Yeah, so you do resort to medication to control it.
Yeah, I do.
Okay, and the symptoms that you get, what are those?
The symptoms I get are very, very itchy throat.
Yeah.
That little globule of skin at the back of your throat itches madly. Itchy eyes.
Yeah.
And of course, runny nose.
If I can just explain to you a little bit about how NLP works. We'll do this with your eyes closed because it just helps you to concentrate and really access the images that we want you to see. But you will be completely aware the whole time of what's going on. You're going to remember the whole session. You're going to talk to me throughout the whole session. If you don't like it, you can stop and open your eyes at any stage. So it's all completely under your control. Have you got any questions about it?
No.
Okay. So what things do you think set you off the most?
I think grass.
Grass. Just for a moment now, for a very, very short time, I'd like you to imagine that you're walking in a field of grass. It was lovely, new, fresh spring grass, and now it's just been cut, and you're walking all the way through this field of grass. You can smell the smell of the fresh grass. You're very aware of all that grass. How does that make you feel?
The eyes are feeling slightly tickling.
I can see your eyes started to shake and your nose started to move. Isn't that interesting to note how the mind has such an enormous influence over our allergic reactions to things? You know, there's no grass here, and yet your eyes have started to feel itchy and your nose has started to react a bit as well. So just noticing that for now, and stop the response now, because there's no need to feel that at this time. What I'd like you to do now is think of something that's similar to grass, but something that you know your immune system does not react to at all. So we want something that your immune system has not made a mistake about. What are you thinking about?
I'm thinking about fir trees.
Fir trees, lovely. And now I'd like you to enjoy a lovely, big, deep breath of grass, freshly cut in spring. And how good is that? I can see on your face. How different is that to 15 minutes ago?
Well, there's no sort of slightly itchy eyes or slightly itchy nose, nothing at all.
No, excellent, well done. So congratulations to you and your immune system. Keep your eyes closed a little bit longer, but enjoy how much change you've created in just over 15 minutes. and enjoy the fact that your immune system now knows exactly what to do for you and will do it over and over repeatedly every time from now on, because it's learnt a new pattern and a new way of operating.
Thank you.
My pleasure. So, how was that?
Interesting. Interesting.
Yeah.
And time will tell, won't it?
It will. So it's now May 2012, which is almost a year since Lesley did her allergy cure session for NLP. And Lesley's here with me today, and she's going to tell us about how she's been for a year since she did her session.
Well, since you did the session, Mel, of course it was winter time, and I don't usually get hay fever in the winter, but come the summer, absolutely no hay fever at all. I haven't had to take any medication. I haven't had a tickly throat or itchy eyes or runny noses, not for the whole summer.
And have you ever had a summer when you didn't have hay fever?
Not since I was about 15 years old. That's a long time ago.
Cool. So when you think back to the session that we did a year ago, you'll remember that Lesley just thought about long grass and it made her nose itch. So we're now sitting in a lot of long grass. So Lesley, if you could lean over and just inhale the grass. How's that?
Not an itch in the nose.
Excellent. So well done. That was all from one session. We actually only did one session of NLP allergy cure on Lesley. Often it takes 2 or 3 sessions. This was one. So well done.
Thank you, Mel. One of the things I really wanted to do was be able to come out to the farm and see my granddaughter without getting all sneezy and tickly in the nose. And I can. I can come now any time and I don't get a runny nose or itchy eyes. Wonderful.